Hi, I'm Brian Ariel, Treatment Director with the Recovery Outpatient Program at Applied Care Services. Today we're going to talk a little bit about co-occurring disorders. Co-occurring means they're happening at the same time. So let's take, for example, depression. So if I'm feeling depressed or I don't have a lot of motivation and I just think basically life sucks and there's nothing that I want to do, then I might find other ways other than talking to a professional or taking medications in order to cope with it. And maybe I might drink or I might take another substance to feel better. And I might be self-medicating my depression symptoms instead of actually seeking professional help. And this happens a lot actually with people that suffer from mental health issues, where they might self-medicate and they feel better for a little while, and it does work, but as a long-term management strategy, it's not a winning combination for sure, because then we can form what's called a co-occurring disorder or a substance use disorder on top of our mental health disorder. Now, a question was posed to me by someone who was really interested in this, and they said, so why when you go to the hospital and you're having this mental health issue, do they ask you if you use substances? And that is a great question. The reason why they ask you these things is to make sure that it's not a substance-induced disorder, which means the substance brought upon what they're seeing right now, what you're currently experiencing as a mental health issue. And so they're trying to differentiate between whether it's the substance causing the mental health emergency, or if you actually do have a mental health disorder in an emergency status. I hope that makes sense. It does to me, obviously, but it's a great question because we will often wonder, well, what does one have to do with the other? And that's where we get to this co-occurring. So if I'm taking substances and I'm exhibiting a mental health disorder, they would want to know, because if the substance is taken away, then the person should resolve those symptoms of, or looking like they have that mental health disorder. And you would venture to say that those would just disappear and terminate, and eventually they would be, I guess you would call, normal or stable. However, if they persist even after the substance, then it's pretty good rule of thumb that they were having a co-occurring disorder and that it wasn't substance induced, but it's actually they're having a mental health emergency. So thanks for that question, and I hope that that answers it. But moving on, substances and mental health, they're not a really good mix. The best way, if we're experiencing a mental health issue, is to go and talk to a professional. Be diagnosed. Like we covered in our previous video on the criteria for substance use disorders, they're going to go through the same type of criteria to see if you meet that criteria for a mental health issue or not. And if you do, then the proper medications that you can get prescribed by your doctor or psychiatrist will help treat those in a proper manner. So we're not being our own doctor, we're not being our own pharmacist, we're not being our own psychologist by trying to medicate away on our own our issues with our mental health. And so it's very important that we understand that if we do have a mental health issue, we are more likely, 2 times to 3 times more likely to self-medicate other than seeking out help. So I hope that this has helped you understand a little bit of the interplay between substance use and mental health, and why we would call co-occurring disorder with a substance use disorder and a mental health issue. We would want to treat those at the same time. Thank you for watching. Again, this is Brian Ariel with the Outpatient Recovery Program at Applied Care Services. Be well and be safe.